Good evening, doctors. Welcome again. Today we are going to discuss about Neet PG 2020 exam practice paper. This is part A. We are going to discuss about anatomy MCQs here. Most common site of Morgagni's hernia is the most common site of Morgagni's hernia is right anterior. Yeah, that is right anterior. Okay. Structure which does not cross the midline is that is left gonadal vein. Left gonadal vein. That is left gonadial vein. Okay. Which part of vertebral canal will show secondary curves with concavity backwards? That is cervical. Cervical. Facial nerve exits the skull via mainly by stylomastoid foramen. Stylomastoid foramen. Okay. Branch arising from the main trunk of mandibular nerve. Branch arising from the main trunk of mandibular nerve is nerve to medial pterygoid. Nerve to medial pterygoid. Yeah. Anterior wall of third ventricle is formed by anterior wall of third ventricle is formed by lamina terminalis. Lamina terminalis. Okay. Which of the following is a true regarding the lateral geniculate body? Layers of 1/4 and 6th receive the contralateral optic fibers. Okay. Which is true regarding suprarenal gland? True regarding suprarenal gland. Please try to answer. Posterior surface of left suprarenal is related to kidney. Okay. Yeah. Pisiform is considered as sesamoid bone in the tendon of flexor carpi ulnaris. Flexor carpi ulnaris. Largest brusa in the human body is subacromial brusa. Subacromial brusa. Which of the following is not a pneumatic bone? Mandible is not a pneumatic bone. Muscle supplies by anterior division of mandibular nerve are all except medial pterygoid. Not included among posterior relation of head of pancreas, that is first part of duodenum. First part of duodenum lies anterior to head of pancreas. Where is urethral crust located? It is mainly located in prostatic urethra. Toynbee's muscle is tensor tympani. Which of the following movements will not be affected by involvement of L5 nerve root? That is thigh adduction. Which of the following is a feature of Y chromosome? That is aerocentric. All of the following are categorized as secondary lymphoid organs except thymus. First costochondral joint is a synchondrosis. The movement of the following joint permits a person to look towards the right or left. That is atlantoaxial and yes movement by atlanto-occipital. Yeah. You say yes is flexion with your atlanto-occipital joint and you say no rotation with atlantoaxial joint. Infection, inflammation of all of the following causes enlargement of superficial inguinal lymph nodes except penile urethra. An inhaled foreign body is likely to lodge in the right lung due to all of the following features except right lung is shorter and wider than left. So this is answer A. They are asking except. A foreign body is more likely to get locked in the right lung as the right bronchus is wider, shorter, and more vertical. After radical mastectomy, there was injury to the long thoracic nerve. The integrity of the nerve can be tested at the bedside by asking the patient to raise the arm above the head on the affected site. Okay. Bar bodies is found in which of the following phase of cell cycle? So we are going to discuss now biochemistry MCQs. This is part A of Neet PG practice paper, and we already finished with anatomy. So this is interface. Okay. A type of joint between sacrum and coccyx is a symphysis. All of the following are branches of external carotid artery except anterior ethmoidal artery. In an adult male, on per-rectal examination, the following structures can be felt anteriorly except internal iliac lymph nodes. The substance which is present in both serum and plasma is factor 7. Site of RBC formation in 20-year-old healthy male is flat bones. A granular endoplasmic reticulum is involved in the synthesis of lipid. All of the following statements are true for intestinal motility except does not depend on gastric motility. Stomach can influence intestinal motility by means of migratory motor complex and gastroileal reflex. Delta waves are seen in deep sleep. The processing of short-term memory to long-term memory is done in hippocampus. Broca's area is concerned with word formation. Renin is secreted by juxtaglomerular apparatus. Which of the following hormone is not secreted by kidney? Angiotensin 1. Hormones secreted by kidney are 125 dihydroxycholecalciferol, renin, and erythropoietin. Adrenaline, non-adrenaline, and dopamine act through 7 pass receptor or serpentine receptors. Iron is actively absorbed in duodenum and proximal jejunum. Bile acids are synthesized from cholesterol. Which of the following organs secrete zinc in a large amount in man? Prostate. Which of the following organ is not involved in calcium homeostasis? Lungs. Cushing triad include all except hypothermia. Distribution of blood flow in mainly regulated by the arterioles. Which of the following a reduction in arterial oxygen tension occurs? Hypoventilation. Ovulation is primarily caused by pre-ovulatory surge of luteinizing hormone. Calcitonin is secreted by thyroid gland. Testosterone production is mainly contributed by Leydig cells. The main site of bicarbonate reabsorption is proximal convoluted tubule. Reabsorption of water in GIT is maximum in jejunum. Treatment of so we already finished with that is physiology, not biochemistry. Now we are going to start with biochemistry. Treatment of multiple carboxylase deficiency is biotin. Biotin is a cofactor of all carboxylase enzymes. Which of the following enzymes is stable at acidic pH? Pepsin. Northern blot is used for separation of mRNA. Southern blot for DNA and Western blot for protein. Study of multiplication of proteins in disease process is called proteomics. Vitamin E intoxication causes injury to lysosomes. First substrate of Krebs cycle is pyruvate. Vitamin which is excreted in urine. Vitamin C. Glycolysis occurs in cytosol. Triglycerides are maximum in VLDL. Sorry, it's chylomicrons. Increased copper excretion in urine is seen in all except hepatocellular carcinoma. Which of the following estimates blood creatinine level most accurately? Jeff method. Vitamin B12 acts as coenzyme to which one of the following enzymes? Homocysteine methyltransferase. It catalyzes the conversion of homocysteine to methionine. Mitochondrial DNA is closed circular. Both vitamin K and C are involved in post-translational modifications. In which of the following condition the level of creatine kinase 1 increases? Brain ischemia. A person on fat-free carbohydrate-rich diet continues to grow obese. Which of the following lipoproteins is likely to be elevated in his blood? VLDL or triglyceride we can say. High carbohydrate diet increases lipid synthesis. There is increase in synthesis of triglycerides and secretion of VLDL by liver. Process used in expression vector to increase yield of recombinant protein synthesis. Promoter induction. Site of urea cycle is liver. Rothera's test is utilized for detection of ketone bodies. So guys, I hope till here it's very much clear for you. If you have any queries, any question regarding this is part 1 of Neet PG 2020 exam, part A. I already finished with this practice paper. If you correct 70% MCQs here, that means definitely you are going to crack Neet PG 2020 exam. Thank you, good day, goodbye. That's all for today. If you still not subscribe my channel, subscribe it, and if you like this video, put like on it. Thank you.